Hi, I'm Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation, and we are back with 5 questions with an ISHLT member. And I am here today with Ann Woolley from Brigham and Women's Hospital in Boston. Good morning, Ann.
Good morning.
Well, let's start with the basics today. Why don't you tell us a little bit about who you are, where you work, and what your role is in ISHLT?
Sure. Well, thank you for having me. As you said, my name is Ann Woolley. I am an infectious disease physician at Brigham Women's Hospital in Boston and Dana-Farber Cancer Institute. I focus on oncology and transplant patients that have infectious complications.
Well, fantastic. What brought you to ISHLT? Why did you get involved? And what makes this a society that matters to you?
So my introduction to ISHLT, I was so fortunate because I work with many members in the transplant community, such as Dr. Mandeep Mira and many other members of ISHLT that are at the Brigham. And when I was a senior fellow in transplant ID, I was lucky enough to have our abstract accepted to ISHLT for their meeting in Nice, France, back in 2018. And it was our project on transplanting hearts and lungs from hepatitis C positive donors into hep C negative recipients. And I was so fortunate that it was accepted, and it was accepted as a plenary oral session. And so my first time going to ISHLT, I got to go to France and had that's wonderful opportunity there. And I just loved the meeting. And I was so fortunate to also at that part of my training when I was a few months away from coming on staff as an attending and got to I'm sorry, that was my first year as an attending. I had just finished fellowship, and I got to meet so many other transplant infectious disease physicians, such as Dr. Ann Woolley from Duke, and I had these great conversations. And he in particular said to me, this is a great community. This is a great society, especially for junior members to really get to know people and to collaborate and to work. And I always remembered his saying that to me, and I started to then participate more and join the society, et cetera. And I really have benefited from that in the past 3 to 4 years. And I've just gotten to have a lot of different interactions with different transplant members and infectious diseases physicians at different centers and collaborating and working together with them. And it's been wonderful.
That's great. And, we hear so much that the meeting is such a jumping off point for people. And it's wonderful that it really was that for you. What inspired your career path? How did you end up in infectious disease, working with oncology and transplant patients? What got you to where you are today?
Sure. So my path was a little bit less direct, perhaps, than some others who decided when they were younger they were always going to be a doctor. I had wanted to and did study mechanical and aerospace engineering in college. And my goal and dream at that point was to work in sub-Saharan Africa, and thought that engineering systems, supply chain, civil engineering, et cetera, would be so applicable. And then it was through my time that I spent in college and the summers and different programs that I did in East Africa, and particularly in Kenya, that I realized what I loved and what I wanted was the perspective for what I brought to that, to be the the physician-patient perspective, just how close you could become and with individuals, and from a lot of the work that I got to do and was fortunate to do in Kenya throughout my time in college. And so that's what made me go on to the medicine track. But then because of that being really inspired by the work that I'd done in Kenya, that I thought that my focus would be on HIV, tuberculosis, et cetera. And it was really in residency that I just really was so intrigued with transplant patients, to the point where I wondered whether or not I was going to actually go into transplant medicine. And then I realized, no, it was that the infectious complications that were just so interesting to me. And I really feel like transplant infectious diseases is such a novel field, in the sense of it's now beyond just patients that get transplanted that are predisposed to these infections because of all the different biologics and the medications that we're giving to other patients, be it oncology patients, patients with different rheumatologic disorders, neurologic conditions. And so it's really opened up, I think, such a fascinating field where we have so much more to learn with it. And at the same time, it's what I love about it too in practice now, is that it is such a multidisciplinary part of medicine, that you can't possibly be taking care of a patient that you're not also talking to the the primary team of be it lung transplant, heart transplant, et cetera, the surgical teams, and just how integrated we can all be together as a team. I've loved that from both clinical wise, how long-term the relationships are with the patients as a result, as well as the research collaborations that I'm fortunate to do.
Well, that's amazing. And you really highlight the interdisciplinarity of what we do. I mean, your story highlights it, right? Just the background that you have, and kind of brings that mindset of looking at other fields and always, wondering what other parts of the care team are doing. And that curiosity is really an awesome part of your story. Is there a meaningful milestone in your career or in the field in general that you'd like to share?
In terms of something to date so far, or in
Yeah,
terms of
something
what
you've achieved or something that, really fascinating that's happening around you at the moment that you'd like to sort of share with the community?
Sure. I mean, I will say we have all been so impacted, obviously, by COVID. And I think that what has been really wonderful in the silver lining of this is that it is just amplified how integral infectious diseases is into the whole transplant care team. And I've been very fortunate to work so closely with our OPO, NEDS in the New England region, to make sure back from end of March, beginning of April, and have this be coordinated, obviously, with our transplant teams to ensure all the appropriate screening and testing needed for donors, not just donors that our center is going to accept, but how can we offer this to other centers as well in the region who may not have the same testing capacities. As we know, COVID testing has really, it was much less homogeneous in the spring of 2020. And so since we were already doing lower respiratory tract samples when we were evaluating our lung donors, for example, how could we ensure that we could provide that to other centers? And so I really feel like it just amplified what I'd already been able to experience in terms of our hepatitis C, hepatitis B work with donors, and to really see how that could just help to facilitate transplantation and not slow that part down after we did pick things up again in late spring. And so that was, I think, a really wonderful experience to be part of, and understand the fact that that is something that will only continue in the future as we're faced with other infectious complications.
Yeah, definitely a lot of lessons learned from this experience. And I feel like this is a trick question whenever you're talking to an infectious disease person because of COVID. But when you think about the future of your specialty, what do you see on the horizon? What's coming down the pike in transplant ID?
So what I think, I guess if I'd answer that question less in terms of particular infections or new pandemics or things like that, which I don't think any of us are ready to to really talk about in what that will transpire, since we're still, though obviously there is a light at the end of the tunnel now with COVID, but really more, I think that's US centric speaking, and we are faced obviously with so many other countries that are dealing with this now, India and many other countries that are not yet having access to vaccination. And so, but I think in general, to answer your question, what I think is down the road is just the fact of continuing to explore the possibilities of how can we make sure from a organ procurement perspective that we are, as infectious disease physicians, making sure that we are decreasing the need to unnecessarily decline otherwise excellent medically suitable organs that the surgeons and the transplant teams would like to accept. And how can we really make sure, there's so many unknowns in infectious diseases, as far as, if you compare our field to cardiology, as far as the number of trials we have to say you have to do something this way, or we know it's evidence-based this way versus that because of how rare things are, and et cetera, the challenges involved with that. And so I think it's really incumbent upon us, and I think we are doing this as a field, to really continue to push those boundaries and to explore that, so that ultimately it's not just about how well we can treat our patients after transplant, but how can we make sure that we are part of the equation to continuing to open up access to transplantation. And that's the part of the field that I find we're continuing to move the dial forward on that area.
That's a fantastic insight. And I think, again, just goes back to this idea of interdisciplinarity and making sure every member of the team is included all the way down the line, because we learn so much more that way. what is your idea of a perfect weekend? What are you doing when you're not saving lives and curing infectious diseases?
Well, I think the perfect weekend, I think for all of us, not many of us have had a weekend really with all this going on. And so I think it's many of us think about our perfect weekends, but joking aside, I'm fortunate that I have a wonderful husband and 5 children that are, my oldest is 11 and my youngest is 3. And so our weekends are jam packed with activities, sporting events and whatnot. And my ideal weekend, honestly, has really been, especially when the non-work things have slowed down, obviously, with less social engagements, et cetera, has really just been really cherishing our time together as a family and being able to actually be part of and be there as my older sons have their baseball season now that is going well, and seeing that and being part of that. And so I think right now I've learned to really enjoy the simple things in life and the stuff that is so important to us, but that really gives me perspective and is the reason I feel like if you're happy at work, you're happy at home, and you're happy at home, you're happy at work. And I'm fortunate to have both.
Yeah, that's wonderful. And I hear that answer a lot, that those simple things are the biggest things right now. And I think that's another silver lining of what COVID-19 has taught us all. Is there anything else you want to share with the ISHLT community today?
I think I'd just like to say thank you, because I feel like I have, as a still in the early stages of my career, I've just really benefited, as I mentioned, beginning from as a fellow to then, the past few years and as, an early career attending with that, just from how open everyone is, from the way the journal to the meeting to the other webinars, between the resources. And so I just want to say thank you, that I've benefited so much, and I hope I can continue to be part of this and contribute to the community.
Well, thank you so much for taking time to chat with me today. This has been terrific, and I'm just really excited to see everything you're going to bring to ISHLT in the years to come.
Well, thank you so much.
Take care.